Hello, my lovely nerds, and welcome back. We've got a very, very special bonus episode now, which came out from the filming that I did with Dr. Jenni, the interview about her incredible insight into the world of medicine and how this can be applied to fantasy. And for this part, we delved right into how magical healing can work and also massive world building implications for medicine in your fantasy stories. It's really cool. I'm not going to chat on about it anymore. Here's the video. Such fun last time talking about all of the different ways that people have been messing up the delicate art of healing the body over the years. I think it just shows that there's so much interest around the subject. I think because people just don't know enough, and this is a great way of giving them that insight into how the body works in general and how these are lessons that we can and should be applying to fantasy. So today's video about how we can create magical powers that basically supercharge our healing abilities in one different way or another. So I think I'll first of all start off with, are there any books that you've seen that have used magical healing really well?
There are lots of different ways I've seen it done, and they all bring something slightly different to the table, which I enjoy because it makes you think, how would that work? So I think the one that springs to mind, because she doesn't actually shy away from writing it, is Tamora Pierce's books about, healing. In her world, she's got two different types of magic. There's the gift, which is sort of like what standard human magicians or mages have. And then you've got wild magic, which is kind of more related to animals that some people have a gift with. And, one of the characters in that series has a gift with. So she explains it as it's two different ways of healing people, which I thought was really interesting. So in her story, the gift is about replenishing someone's magical sort of core, and it allows them to heal themselves. And then the other way was wild magic, which is using, literally knitting bones together again and knitting tissues. So she has to have an anatomical knowledge so she knows what she's putting back together. I think another way I think of it is, I certainly think about when they mention healing is The Last Airbender. So obviously a TV series rather than books, but you've got the waterbenders who are supposedly healers. But when I was trying to think about it, I was like, how would bending water heal you? And it's never really fully explained. And I always think that's a big shame, because I would love to see what they meant by that. Because for me, pushing water around a body, I can't see how it would heal someone necessarily.
So this one I've actually done a load of thinking about. There's all sorts of ways when, say someone's, is exhausted, like actually you could be taking over the pumping of their heart. It could be so that you're keeping that going during surgery, or you're diverting the blood vessels so that you can do some healing there. But it's a really interesting point you make there, because it touches on a comment. I think it was Meppa who commented on the magical healing video I recorded a while ago. There's two sides of the coin for it. You have the ability to heal, but then you also have the magic ability could be pushed too far. It could actually end up causing harm and injuring. And I think your waterbenders example is perfect for that, because there is the bloodbenders who are almost just pushing the healing ability off the other side of the knife edge.
Yeah, I think it's really interesting because, it shows, in medicine, you've got drugs that are both used that are like good in certain doses and really important, but in a high dose, it could kill you. And I think it's a really cool idea to explore that with magic. Is there a danger that you've done too much? Are you pushing things too far to the extent where it could be used as a weapon against someone? So I think that's a really fun concept to explore. And there's also the kind of principle that we talk about in medicine, which is do no harm. And sometimes we have to recognize that over intervening for people can actually cause more harm overall to them. For example, someone who already has like a late stage cancer, and we know maybe only has a couple of months to live, and aggressively, if they get a lung, for example, full of fluid and it keeps refilling, are you going to aggressively stick a chest drain that is both aggressive, painful and invasive every single time? What are you achieving with that? So it's over investigation of certain things is a really important concept. I'm very oversimplified that, by the way, but there are a lot more issues surrounding it. But it's always worth considering, like, are you doing too much? And I think medicine as a concept, when you're using healing to illustrate that, I think that'd be really fun to do. Are you over healing someone? Are you keeping someone going to the point where they don't want to be kept going anymore? Have you overdone it and damaged them?
Something I don't think I've ever seen explored in fantasy. And I will say, I love that when I asked this question, I was thinking of something different and you took it in a different direction there. You were talking about like the actual medicines being applied slightly too much. I was thinking also in terms of, most medical healers in, I think, real world and mostly in fantasy, they go into the profession because they want to help, right? Yeah. We do hear of occasional rogue elements who are healers who actually use the ability in bad ways. But I often wonder about almost the strains of medical professional on these people, to see people suffering all the time, almost seeing how these individuals are almost like they turn from wanting to heal to actually doing too much, going a bit more chaotic in what they're doing, just out of the pain of what they've been through as a healer.
I mean, I think certainly it would be a really cool concept to explore. And, in medicine, obviously, we're trained and selected so that we don't go maverick and do crazy things. And, but we've got robust structures in place that are meant to prevent that from, we're meant to look out for each other, and we don't operate alone. It's even a GP in a GP practice will have colleagues, and so it's pretty rare for us to go alone and do our own thing. And once you're alone and doing your own thing, you lack that peer pressure, which in most cases is a good thing, to stay on the straight and narrow. And in a fantasy world, that infrastructure and that selection process may not exist, for example. And so you might get people who are more willing to bend the rules and do terrible things. So
not necessarily with the intention of harming. It's something that I always think about when it comes to every bit of knowledge that we have right now when it comes to medicine. That came from a learning experience of the past. Cauterization, the ability to tie off blood vessels, the knowledge that we need to knock people out maybe so we can actually do the surgery without them passing out from the whole process. All of these are hard-won battles. And I always wonder, when you hear about surgeons of the past who were, army medics on the battlefield, they were hacking at limbs, there seemed to be a bit of egotism. They were doing this without really feeling the consequence, without anyone's watchful eye on them. And I do wonder if that's something we should be seeing more in fantasy.
I think certainly our safety procedures are in place for a reason, and I'm glad that they are there. But certainly back in the battle days, when we're talking about Victorian ages, back into the early kind of 20th century, there really wasn't these structures in place, and people would just they would suggest an idea, people would be like, sounds all right, and they would try it. So there was a lot more sort of maverick I think it'll work, and it didn't always, sadly, but sometimes it did, and we have some of our pioneered techniques from that. So progress, it might be a little bit more challenging now, because you can't just go and try it out for good reason. Why would you do that? So when we've got structures in place that allow us to develop things more safely. But yeah, back in the day, people would do crazy things. But it's also worth bearing in mind that a lot of medical innovation happened on a battlefield, because that was the place where you'd have these terribly injured people and they'd be doing terrible things. And so you'd have a lot of innovation there, but also there is a dark history to that as well. Medical experimentation on, people who had not given consent, prisoners of war. There is a very dark history associated with that, and it's not that long past either. A lot of us don't really want to think about it, but I think it's important not to shy away from the fact that medicine has a very dark history of treating those in minorities or those of enemy states or anyone they consider lower than themselves. Unfortunately, usually white people treat other people of other races very badly. Doctors are not the saints through history that you would hope they would be. So I think, you can include that in your fiction. There's no reason that you shouldn't. I just think it's important to understand where some of our knowledge has come from. I read a very interesting article in the BBC, actually, I think it was a couple of years ago now, where it was a surgeon talking about very complex surgery. And there's one textbook that is apparently better than the rest of them. But the reason that it's so good was because it was written in Nazi Germany when they were literally vivisecting people. So the reason it's so good is because it was based on live specimens. But the way that it was brought about was so unbelievably awful that this textbook is very difficult to find these days, and for good reason. You don't want to celebrate the work of someone who was torturing people. So it's one of those really difficult situations where you've got this book of very, very technically brilliant illustrations, but also that it's a result of torture and killing people. And
medical healers of the past were probably, rightly so, a bit more feared than medical healers of the modern day, really. Like, I think if you went to a doctor in the past, then I think you'd be quite wary that your chances of surviving are probably not great at that point. And I don't see that reflected in fantasy all that often.
If you've got a character who's injured, the control is out of their hands because they're needing to see a healer. The control is all with the healer. And one of the things that makes people feel afraid is that feeling of not having any control over a situation. And unfortunately, with injuries and severe illness, that can be exactly the case in that situation. And learning to put your faith in someone else and say, okay, please fix me, is a really difficult thing. And it's an honor that patients put trust in you to, and that's why I think it's really important that you maintain that doctor-patient trust with a patient. But in the fantasy era, you might have these mavericks operating. I don't know what they're doing. I don't know what's going on. Like, you would be afraid. You would be going through a process of, I've had this serious injury. Am I going to die of this injury? Is this healer going to do something to me? Oh my God. Like, I am firmly in the process of, magic being a pain-free, easy process that's quick and easy. Like, I guess you can write it into the world, but it's not the most interesting way that I would write it, because frequently in this world, injuries aren't a quick process to get over. They're not, an illness, it takes time, and it's not necessarily pain-free, unfortunately, as much as we would like it to be. So, I think it's a quick and easy fix if you want to make it pain-free. And fair enough to you if you don't want to go into detail on that one. But if you do, I think it's an interesting avenue to explore in terms of characters. And the other thing, I guess, is, these healers, they might be like these airy, fairy, fluffy, happy people who always heal people. But, having worked with doctors, most of them are really cool people who aren't these airy, fairy, light-headed people. We've got, we're made of sterner stuff than that, because actually on a daily basis, we might have a cardiac arrest happen, and we have to be able to go from 0 to 100 dealing with an emergency in seconds, and you'll carry an arrest bleep and it'll go off, and you literally have to drop everything and run, and get there, maybe do CPR. It's the patient is effectively dead in front of you, so you're trying to bring them back, and sometimes we have success and sometimes we don't, and then you have to go back about your day with almost no rest time afterwards and just get on with it. And if you were these airy fairy, always going to help people and nothing happening, like, you wouldn't be able to focus. you need to have a bit of a way to get past that on your daily job, because we see traumatic things, like, and it does affect us. It does, it's never going to not affect someone. But I think having your healer having some kind of way of coping with that, whether it's that they're a stronger person who is able to cope with that kind of thing, or if they turn into a gibbering mess and people are like, well, this person's probably not got it what it takes to do this long term, for example, or write that into your story, make them a character, or have them be, I don't know, really badass. I would love to see a badass healer who uses their healing powers for both healing and also, if necessary, can defend people with it. I think that would be really cool. So there are lots of different things you can do with it, definitely.
Yeah, I love all of these points. I want to see more mavericks in healing. I want to see more innocent souls breaking down and being destroyed by the gore that they're witnessing as they try to heal. You kind of circled around another subject that I'd love to see this more represented in fantasy. You are probably very aware of this. There's a lot of biases in medicine right now based on knowledge of the past. So, for example, I found this absolutely mind-blowing, but when a lot of research was being done over the course of time, men were considered as the standard and women were considered as just men with hormones. So there was no understanding that actually women's bodies work in very different ways from men's bodies. So when it came to clinical trials, a lot of research was just done on men. So there was no investigation of actually, do these drugs work the same way in women? Do they work the same way in people from different races? And it was fascinating to me to see that, because that's a product of our own cultural biases over a very long period of time that have resulted in the medical system we have today. But we're fantasy writers. We're creating worlds that don't necessarily have the same cultural biases. So what ways can you have that in your world? Yeah, I'd absolutely love to see more writers looking at, completely throwing out the rule book, saying, no, actually, we did all our investigations on women or on dogs, and therefore actually most of our medicine doesn't really apply to humans that well.
Yeah, there's a lot of this, like the men who were doctors would justify that because women had monthly cycles and varying sort of bodily states depending on times in the month, they were like, well, this is not a steady state, therefore can't trust the medicine on it. Which actually, when it's 50% of the population, that's really not an excuse. So it's a huge pet peeve of mine that their standard is as a white man in his 20s and 30s seems to be their standard testing. But definitely there is a gender imbalance in this world, and I would be really excited to see it explored differently in a different world. So remove your biases about how life is lived here and build something completely new. I think that would be great.
And not just when it comes to gender. I always think about, if we didn't have such stigma against people being gay or bisexual or whatever, would that have meant that the situation with HIV in the 80s, 90s would have been completely different from what it ended up being? So I would really love to see more people explore the kind of worlds that can be created just by looking at what your culture cares about. So, in terms of gender, in terms of race, in terms of sexual orientation.
When I think of medicine, I think, what are the structures in place? Are they person-centered? Are they, society-centered? What is the goal of medicine in this world? And it gives you a way of thinking about when people are at the start of their life, the end of their life, when they're in their crisis moments, what kind of care do they receive? How does society think of them? What is available to them? I think that's a really interesting way of looking at society. It gives you a different lens to examine it and think, actually, who gets priority treatment? How have we developed this over time? And it gives you such an interesting way of looking at the world, its history. It leads into the social side of things. How are women treated? How are minorities treated? How are men treated? It gives you this kind of way of a route in almost to look at the other areas of world building and see, how has society informed medicine and how has medicine informed society? So I think it's a really cool way of developing a world.
I couldn't be more with you if I tried. I'm going to finish with one final question before I let you go. If you were a fantasy healer in a story you've created, or a story, maybe Lord of the Rings, what magical healing ability would you love to have?
Oh, that's a really, really good question. You made me think. I think sometimes diagnosing someone's problem is actually one of the most stressful things. So I guess it wouldn't be that useful if I didn't have a way of treating it afterwards. I would obviously like the ability to fix it, but I think the main way would be being able to sense where the problem is and what the problem is exactly. So, is there a blockage in a certain artery? Is there an infection somewhere? And having that kind of ability to lay hands on and diagnose, for example, because so I have seen patients who have been through scanning and they've got a problem like pain and we don't know why, and it's so frustrating for them. So having the ability to just say, this is what the problem is, would be wonderful. I mean, I would love also to have the ability to treat it, but half the time getting to a diagnosis is part of the problem.
Surely that would mean that it would have a knock-on effect on your ability to develop new treatments, because a lot of treatments that we designed, we probably would, designing them for the wrong cause. We were thinking, oh, this person's got this when actually they had that. And so it was hindering our ability to make new treatments. So I imagine you being super amped up with your ability to identify the source of the problem, what's causing it, you'd be able to, first of all, suggest much more appropriate kind of treatments than probably some of the cuckoo ideas that we have had in the past, but also be more likely to figure out that it's working or not. So I love that idea. If ever we do randomly get superhero powers, I hope you get that one.
It would certainly be useful in my day-to-day jobs.
Thank you for coming on the channel again. It's been absolutely fantastic having you, as per last time. And do you want to tell people how they can follow you on Twitter? Because I know you're on there and you're very active on there.
Jenni_Coots on Twitter. I also have an art Instagram if you fancy following it. It's called @JenniCootsArt, no spaces. So feel free to follow me. And occasionally, I don't tweet about medicine that often, but if you ask me questions, I will happily answer them. So, but thank you very much for having me back.
Well, thank you so much. Have a great day. All right.
Well, thank you.
All right, that was it for the conversations with Dr. Jenni. She and I were talking about all sorts of fantastic ways that I can get her back on the channel in the future. Hopefully, when we delve into the ultimate of magical healing when it comes to necromancy and, you know, just resurrection magics in general. So check out a future video where I'm sure she'll appear again because she has such amazing insights. Thank you, Dr. Jenni, for joining us. All right then, everybody. I wish you all a fantastic week. Like and subscribe if you haven't already. And please do let me know in the chat what you would love to hear more about when it comes to the world of medicine. Give me everything that I can throw at Dr. Jenni as ways of enticing her back onto the channel. Please, I want her back. She's great. All right, everyone, have a fantastic week. Goodbye now, my nerds. Goodbye.